Today, to start, we're going to do the resting heart rate and blood pressure. We already did the blood pressure because we don't have a cuff available, so we had to go to the store and do it. So that's already done, but we'll do the heart rate. So I'm going to take it by palpation for 10 seconds. Alright, so that's done. There was about 12 per 10 seconds, so times that by 6 to get it per minute. Next, we're going to do the height and weight in order to calculate your BMI. So without shoes, stand up against the wall. I'll make a mark on the wall, and then we're going to measure it because that's all we can do today. So we've got to try to keep this as flat as possible. Okay, there's the mark. So now I'll get you to hold this on the floor, as even as we can get with the floor. Alright, so about 67.5 inches. Now I'll get you to step on the scale and we'll take your weight. 141.2 pounds.
So, like this?
I'll tell you. Next is the waist circumference. So I'll get you to stand with your feet shoulder width apart and your arms crossed around your chest, just so you're sitting comfortably. I'm going to find the top of your hip and make sure that this sits right there. Okay, now breathe in and out. Alright, so about 30.5 inches. Next is the push-up assessment. So what I'm going to do is get you to do as many push-ups as you can without touching the ground. I'm only counting ones that are in good form, so remember to keep your back and body in a straight line. And if you have any pain or anything, make sure you discontinue doing them. So I get you to start anytime. Good. Straight to these hard ones. Okay, good. 33, so that's an X. Next is the one leg stance assessment. So we're going to start with the eyes open test, and we'll do 2 of them. So the client pick which leg he starts with. He's going to raise his foot just up past the ankle of the other foot and keep his hands beside him. We'll do this for a max of 45 seconds. The time will stop though, however, as soon as the client loses balance. So you should start whenever you're ready. The chair is there if you need balance. Remain in good form. Oh, 39. And start whenever you're ready. Again, remain in good form. and that's 45 seconds. So now we're going to do the eyes closed. So if you want to switch back, you're going to close your eyes this time when you do it. And again, max of 45, and I'll stop the time when you lose balance. Whenever you're ready. Okay, 14 seconds, we'll switch to the other side. And again, whenever you're ready. Okay, in 15 seconds. So that's the end of the one leg stance.